gives me great pleasure to welcome Lucy Youdale, who's going to tell us what this is really like. Lucy.
Good morning. It's a great privilege to be here today to share my story with you and to represent so many people living with pain from IBD, and I do hope I do them justice. Whilst I'm very much out of my comfort zone up here, I've actually got a lot to say, but I will try and keep it brief in the interest of time. My pain is exhausting, and it's rarely just pain. If not accompanied by diarrhoea, fatigue, or other debilitating symptoms, it's accompanied by a spiral of anxious, ruminative thoughts about what the pain means. My IBD began 23 years ago, and pain has been a regular, unwelcome guest in my life ever since. It's there nearly every day, sometimes hovering like a ghost in the background, and at other times making its presence felt much more acutely. I've spent a lot of the last 23 years trying to fix my pain, trying to get someone to take it away, and essentially trying to avoid it. And in a room full of experts, I'm fairly confident that most people here will agree with me that pain cannot be avoided. Well, it can be avoided, but it comes at a cost. And this story, my story, is a story of just that, a life of saying no in order to try and avoid pain. So I'm going to set the scene a little bit. Growing up, all I ever wanted to be was a nurse. Call it destiny if you will, but I always knew I'd end up working in healthcare. It was my dream. So age 19, off I went to university, and I'm literally having the time of my life. Nursing is everything that I hoped it would be. I'm making lifelong friends, I'm loving the work, the learning, the parties, I'm loving life. And I came home for Christmas after my first term, and this is when things started to unravel. My first symptoms of IBD struck, and I remember it like it was yesterday. Pain so crippling and excruciating and coming out of nowhere that it stopped me in my tracks, and it took my breath away. And I tried to shake it off, but equally it was very frightening, and nobody could tell me what was wrong. And back at university, the pain kept returning, and I was tired all the time, and it became more widespread, affecting all of my joints. And eventually I saw my GP, who duly sent me off to hospital. And by this time, I'd read up about my symptoms. I remembered my family history of IBD, and I suggested, could it be Crohn's disease? And the doctor admonished me, and so did several others. I was told it couldn't possibly be IBD, that there was nothing wrong, and to go home. And so feeling disbelieved that I was making it up, that it was all in my head, and doubting and questioning myself and my body, I became increasingly disconnected and disenfranchised with my care, until eventually, several months later, following numerous emergency admissions, I was finally given a diagnosis of Crohn's disease. My relief at finally being believed, at finally having clinical tests showing how ill I was short-lived, because I was starting to feel my life change, and it was to get worse. University told me that I should leave the course, that I should give up nursing, that it wouldn't be the career for me because I wouldn't be able to cope with the physicality of the role. But all I ever wanted to be was a nurse, and no one was going to tell me that I couldn't do it, and that I didn't have what it takes. And it was a struggle, and it took me longer than my peers, but I persevered, and eventually I qualified as a mental health nurse a couple of years later. Bravo, you might think, but still it got worse. I got a job, and I worked hard, I loved my job, but the problem was I couldn't do anything else. My pain was so exhausting, so that when I wasn't at work, I slept, and I was literally existing to work. Well, that's okay, I thought. I'm living my dream. I'm doing what I've always wanted to do. I can tell you that it felt deeply unsatisfying, and it cost me. It influenced my decision not to have children. It cost me my social life, my hobbies, my travel dreams. It cost me friendships, and ultimately, it cost me my relationship with my fiancé, as I had nothing left to offer anyone or anything else. And looking back now, I am filled with sorrow and sadness for that girl. She's like many of my patients now, making difficult compromises in a life that is hard. But also, I'm amazed at that girl. and at humans in general with our capacity to just keep going in the face of enormous suffering and adversity. I was constantly at doctors and hospital appointments, but I was rarely asked about my pain. And even now, unless I'm flaring up, nobody asks me about my pain or fatigue. And until very recently, if I raised these concerns, they were met with dismissal, adding to that sense of powerlessness I felt when trying to find out what was wrong with me 23 years ago. And what I now know and suspect is that, truthfully, those doctors and nurses don't have time to ask me about my symptoms if I'm not flaring up. Failing healthcare services and national shortages of healthcare staff mean that IBD clinics, even when interested, aren't funded to manage those symptoms. And secondly, is that the healthcare professionals dismiss my symptoms as they don't know what to say to me, as they don't understand pain in IBD, and they feel as powerless as I do. But the problem is, when we're faced with situations where we feel disbelieved, we tend to stop talking about our pain. And so if nobody's asking us about it and we're not talking about it, it gets missed. And given that pain is one of the top presenting complaints in IBD, I find it astonishing how little I get asked about my pain. And then there's the treatment for pain. So I'm one of the estimated 70% of IBD patients living with persistent pain. And medication for most of us living with IBD is a challenge. It's a game of trial and error, and no IBD patient is the same. And in addition to trialling most available medications for my IBD, I've also tried most pain medications over the years, but they all come with a host of side effects which generally outweigh the benefits. And I was recently reminded of this when I took just 2 doses of an opiate when I had shingles recently, and I had pain lasting several weeks from the constipation that followed. And that was accompanied by a lot of negative and anxious thoughts about why I'd taken that medication in the first place, knowing that that was probably going to be the outcome. So anxiety, as we know, is very common for people living with IBD, and we know that anxiety and depression can exacerbate physical health problems. But my personal view is that IBD is traumatising. The tests, the procedures being poked and prodded, the loss of dignity associated with the invasive nature of the tests and the examinations, living with the accidents, the enemas, and every embarrassing moment you can possibly imagine can leave us feeling exceptionally vulnerable. And the diagnosis of IBD is life-altering, and whilst the treatments are life-saving, they are not easy to accept or live with, and the changes and adaptations that we need to make seem never-ending. And recent research related to my work for my master's degree highlights that trauma is associated with increased pain severity and disability in patients with chronic widespread pain, leading to worse outcomes and poor responses to treatment. It therefore seems logical to me then that trauma in IBD is going to result in a very, very similar outcome. My thoughts and anxiety related to my pain and my IBD are often based in reality, and that makes them difficult to challenge and dismiss. And I qualified as a cognitive behavioural therapist over 10 years ago, and I can tell you that I have thrown the CBT book at myself over the years, and I understand the importance of pacing, routines, eating well, sleeping well, managing my stress and anxiety. But it hasn't been enough. I've still been living a life of pain and a life of saying no. And that is until a change in job roles in 2016 kind of helped me put a different perspective on things. I moved to a persistent physical symptom service based in Cumbria, and in this role I began to learn more about pain, and I started to ask myself, what is my pain? How can my pain be bigger than me? And I started viewing my persistent symptoms in the same way that I view chronic low back pain or IBS, learning how sensitization of peripheral and central nervous system pathways and the modulation of these was due to complex interplays of biopsychosocial factors. And I began to understand the benefits of CBT in my self-management, but I started doing it in a more valued way, revisiting the things that are important and meaningful to me that I'd spent over half my life saying no to. And I then set myself some new goals, small goals at first, but gradually becoming braver, going further, realising that my pain isn't bigger than me, and it certainly didn't necessarily increase or mean danger or disaster was imminent. And I've got myself to this point. I walk and run mountains most days without fear of pain and without worry about lack of toilet facilities. I have a social life now. I have hobbies. I can do volunteer work now. I am studying again. And I have amazing friends and family, and I have the time and energy available for them. I am realising hopes and dreams I thought were lost. And in addition to that, I'm supporting the people that I work with to begin achieving their hopes and dreams in spite of their symptoms and in spite of their traumas. And they constantly inspire and motivate me every day to continue in my pursuit of making a difference for the people that I serve. I still live with pain, but rather than struggling with it and trying to avoid it, I've moved to a stance where I'm accepting my entire present experience, including the unwanted pain, thoughts and emotions. I'm not trying to get rid of my pain, but I am changing my response to it. And I don't always get it right, and sometimes I pay for my choices later. But I have choices now, and for such a long time it felt that I didn't. But we need to remember that I'm a healthcare professional and I understand how health systems work. I'm reasonably assertive, intelligent and well educated, and I have struggled to feel empowered and supported to manage and understand my symptoms. So imagine what it must be like for some people living with IBD, feeling ashamed, feeling unable to ask questions, feeling dismissed, and living with the trauma that comes from having a life-changing and potentially life-limiting illness. And that is why Crohn's and Colitis UK and these projects that they support offer such hope for me and for everybody living with IBD. And high-quality research is fundamental in improving the care for us. That everybody living with IBD feels listened to, understood, empowered and supported to manage their symptoms in order that they can really live and not just exist, will one day hopefully become a reality thanks to some of the work taking place in this room today. I hope I've given you a tiny little snapshot of what it's like to live with IBD. Thank you for your time this morning.